Oh, I'm so sorry I'm late. I'm so sorry. You know, I'm a nursing student, so I was practicing in my lab practice room. I'm so sorry. But I want to thank you for inviting me to Valentine's Day. Thank you so much. I didn't expect you to invite me out, especially when I'm so busy. You're lucky I got an hour or two to hang out with you, because normally I don't have time. Hi. Hello. I actually, you said you didn't have any plan for Valentine's Day, right? I actually have an idea. If you don't have any plans and you just want to hang out, you don't mind doing anything, right? You said you don't mind, right? So I do have suggestions of you know, what to do on Valentine's Day. I think it would be very romantic. But I need you to come to my house first. It's really close to this park, actually. Is that okay? Hello. 情人節快樂啊. Is that an anesthesia thing? No. Don't worry about that. It's nothing. Don't worry about it. 你唔介意嚟我屋企嘅話 OK 嗎 OK 嗎冇乜特別，我哋純粹意識下係咯你唔介意啊嘛，好近嘅咋，好近呢個公園嘅咋 OK Let's go Do you wanna go to my home? I don't have a basement. 我只是说我们今天情人节不如来我家我们可以一起在我家度过，好吧？好吗？好吗？好吗？一起来我家，因为你都没有什么想做的，那就来我家任我做什么都好吧。不是病娇，我不是病娇，我只是个护士学生，只是一个很正常的护士学生，对，我们一起去吧，好吧？好吗？好吗？去我家，大家一起说好。Let's say yes. Say yes to my house. Come to my house. Yes. Say yes. Say yes. 这是我上课的制服，对，我像护士课的制服，我自己弄脏了一点，对不起，yeah, I just I'm a little clumsy sometimes, and the mannequins, sometimes if I inject into them, they spill blood, they spill fake blood, so yeah. Don't worry about it. Don't worry. I'll be safe. Don't worry about it. I won't do anything to you. Maybe. Anyways, let's. Why don't we go? Do you want to go? Do you want to stay here? It's really cold outside. It's really cold right here. How about we go? 那只是我练习的东西，对，只是我在用来练习的东西。 没问题来我家吧，来我家吧，好不好？好不好？好不好？你不想待在这里吧？很冷今天很冷我们一起去 ，Come on，Come on，follow my house。Someone, come on. It's really close. Just come to this back alley. 很快就到了，这个是捷徑，對，呢個捷徑嚟㗎，好快到㗎啦。Come on。You're here. Oops. What the fuck? Anyways. Hello. Hi. Welcome to my house. Hi. Sorry, this one is M size. I usually wear small. Anyways, hi. Hello. Shh. Shh. Don't scream. Hello. Welcome to my house. Hi. I have a lot of different contraptions in my house. Don't worry about it. Don't worry about the blood. Don't worry about it. Hi. 天使さんいらっしゃいませ。こんにちは。ジョーさんこんにちは。シーフォンさんこんにちは。クリスさんこんにちは。ホフォンさんこんにちは。ミルキーシェアさんこんにちは。ブレンさんこんにちは。ブローウォーターフォックスさんこんにちは。新婚ゾーンいらっしゃいませ。こんにちは。カナさんいらっしゃいませ。こんにちは。エディこんにちは。こんにちは。こんにちは。こんにちは。Hello, welcome to my humble house. Yes, I finally changed my my table mat to eclipse. I should have turned it around, but that's fine. I should make it face you guys. It's fine, but hi! Welcome to the Valentine's Day stream, even though it's a bit late. But do you know what? It's Valentine's Day for you guys! Yeah? 한국어빈, 섭이디모. Happy Valentine's Day! 你好好玩着，先散了，明天早班。谢谢你过来哦，拜拜，拜拜。Happy Valentine's Day， 生日快樂。So you promised me we can do anything you want. So how about we do some practice? Can we do that? Can we do that? You don't mind, right? You don't mind doing some practice with me? I really need to practice. You don't mind just hanging out with me. You don't mind doing anything. That's what I like about you. Do you know what? Yeah, that's what I like about you, you know? So why not we do something? Why not we practice? Why Silas open his leg? Well, I have to. That's for practice. Don't worry. I'm gonna. Let's lay you're on the bed. And let me just spread your legs a little bit. Don't worry about it. Chocolate? I showered yesterday. Don't worry, I showered before this date. How should I present this? It's okay. Let's just put it in. Or maybe. Well, you know what? It's fine. Anyways, I'm wearing. Don't worry. Why am I wearing PPE? No, I know you're not. You don't have anything infectious. I'm just wearing just in case, you know. I'm just wearing my PPE just in case. Just in case, you know. Anyways, how about we start our first practice. So, I have to practice putting a catheter. You wouldn't mind that, right? You wouldn't mind me putting a catheter in. You said you need to pee really bad. So let me just get my straight calf to help you pee. Let me get my straight calf. Oops. Excuse me. Alright. Where is it? Uh-oh. What? Shut the fuck up! Anyways, I have my things. Don't worry, I'm not sick. Hush. I'm not sick. Okay? Do you want me to be smaller? I can be smaller. It makes it easier for you guys to see on the screen. I can be a little smaller. Just a little tinier. So you can see everything. You can't even see my mouth move because I'm wearing a mask. I should wear a mask. Hold on. I can wear one. Where is it? I don't know where it is. There you go. I wear a mask because I'm not really talking much. Well, you can't see my mouth move. Does it work? There you go. It works, kind of. There we go. Mask on, so you won't get the sickness in the brain. Anyways, let's just start this. Why don't we? Okay, don't worry. I'm trained somewhat. So I have my catheter here set up. I have my sterile gloves as well, because this is a sterile procedure, right? So, well, first of course, I'll introduce to my patient. Hello, my name is Curry Fishbowl. I will be your student nurse today, and I will help you. Since you just did a surgery and you need some help urinating, I will today I'll put a straight catheter inside you so you can urinate now. Yep. Is that alright? Is that, you don't mind, right? Yeah, you don't mind. Anyways, and what I would do is I would put my sterile area. I will set up my sterile area, sterile field around your legs, between your legs, and then it's fine. You get the gist. I'll set this up first. This is non-sterile gloves. I'm just gonna open my sterile field. I'm just gonna touch the 1-inch border. 1-inch border. Right? Try not to touch anything inside, because you don't have sterile gloves on. Alright? That's good. And I'm gonna change to my sterile gloves. I'm gonna put this aside so I can see how I put on my gloves. Hold on. Okay, I'm gonna take my normal gloves. I wear a 6.5. When they first measured me, I'm a 6. But that was too tight to get it on. So now I'm wearing 6.5. So, this is also a sterile field. So you can only touch this 1-inch border, because you're not sterile. But the glove inside is... Hold on. Takes a while. Okay. So here's my sterile gloves. And I'm going to pick it up here, because this is the inside of the gloves. Pick it up. Wear it like this, and then I'm gonna pick up the other one from the inside. It doesn't really matter because your gloves are sterile, but the preferred way. And now your sterile gloves are on, like that. Yay! Sterile gloves are on. You can fix it from the outside of the gloves if you need it. But yeah, and then I will go back to my sterile field. I don't have much room here to show you, so I'm gonna pick this up. But normally, you don't pick this up. You just you would get your sterile gloves on another table and just leave it there, so you won't contaminate yourself, right? But right now, I'm just demonstrating, so that's okay. And what I'm gonna do? So first we're doing a male first. So you can pretend this is the penis. I don't need this specimen cup, or if I need a sample, I would use it, but I don't need it now. I'll put it away, and I'll this is a drape. The shape, you can see there's two sides. One is shiny, one is more absorbent. So you would lay the absorbent pad between their legs,
like that. Right above your sterile field that you just set up. You'll lay it there, but I'm not gonna lay it there right now because I don't have space to show you it. But yeah, you'll lay this underneath them. And then if it's a male, you would also lay this I forgot what it's called. Penetration pad. But yes, there is another layer of protection. As you can see, there's a shiny side and an absorbent side, and you would just lay it right over their genital area. For female, you don't have anything sticking out, so you don't really need it. Need this layer, so you can just, you know, not use it. But for male, it's better to have this, so you won't get stuff everywhere. You get me? Yep. And then in the tray, there is your straight calf, and also lubricant, and also cotton swab, which I don't have it. I don't have the sterile cotton swab because I use it in lab, but that's okay. I will just use something else as cotton swabs. Pretend it's cotton swabs. But first, what I do, I didn't touch anything. Pretend like I didn't touch it. I just like lay it over, not touching anything. Unsterile. He's not erect. I'm just putting it like that. Okay, hold on. I'll put it better. There, are you happy? Anyways, we're gonna first, I'm not gonna actually do it, but I will lubricate the catheter. This is too, like, this jelly is not what people use in the hospital. They will use like a syringe one. It's like a more liquid lubricant. Is it painful? A little bit, but we have lube. You would lubricate the catheter, and then that's good. Put it away. Lay it here, and then pretend I have cotton swab. I don't have it. I'll use a pen. Pretend this like cotton swab to clean the area. So for male, I would just clean the tip. Once, twice, thrice, because there's 3 cotton swabs in there. So yeah, you'll clean it. And you see my left hand is already contaminated because I'm holding their genital. So we're just gonna keep holding it. And then I'm going to start. I forgot to open the cap. Oopsies. And then I'll slowly insert the catheter. For male, it would be 7 to 10 inches. So it's going to be about like that, at least. And when you see urine for straight catheter, you stop. And then urine should flow out of this tube into this tray. You can just like let it go, like pee, go piss boy. And then that is straight catheter to help patients urinate. Yay! Very easy. For female, it would be first of all, I don't have to use this layer, and I also when I clean a female, I would have to open their labia minora to expose the urethra, and I would have to keep holding it so it wouldn't contaminate. And I would when I clean a female, I would have to first clean the labia minora and the other side labia minora, and then go straight down the middle to clean with the cotton swab. and then I will keep holding it, and then insert about like 3 inches, because female's urethra is much shorter, and then I'll try to hold it there, and then let her pee. When you see urine, same thing. When you see urine, you can stop and let them urinate into this tray. Yep. So that is straight catheter. Pretty easy. But sometimes patients are maybe incontinent. They couldn't control, which is they can't control when they urinate. So they might need a indwelling catheter, or what we called as my brain short-circuited. What is it? I always remember the other word, but I don't know why. I was trying to remember what it could also be called. It's called Foley. Normally it's called Foley in the hospital, but it's also called indwelling because you have to like keep that catheter is the one that you keep it inside you for days.
いらっしゃいませ。こんにちは。中野さん、こんにちは。いらっしゃいませ。情人節快樂啊！
我今日喺呢度demonstrate 緊呢個插尿喉啊，係呢個插尿喉。I can't really explain this in Cantonese. It's hard. I learned this in English, so I don't know how to translate it. But basically, that's how you 呢個你點樣插？呢個係 straight calf， 就係咪直入式咧？我唔知。呢個係俾你即係即時排尿嘅呢個 straight calf， 就係得我可以見到就係得一條管嘅啫，係咯。甚至佢幫緊我 demonstrate， 我可以用翻自己嘅，我可以用翻自己嘅。不過我自己幫自己好似有啲奇怪。If you're not comfortable with stylus, I can do it with me. I guess we can do female anatomy as well. Alright, so that is straight calf. Did I put anything? Oh, okay. I'm gonna put this back inside. I don't really see much straight calf in a hospital. Usually it's people use it when they really need it, when they can't pee. So most of the time I see Foley, which is an indwelling catheter. Foley has a special thing which has a balloon you can blow up. And I will show you how I blow that up soon. Give me a sec. I'm not gonna put my sterile gloves on again because you already seen how I do it, so I'll just talk about it. Hold on. So I'm going to use a Foley now, or indwelling catheter. So again, I'll set up my sterile field. When we open this, we go away, put this away, side, oops, put it here, towards, right? And then same thing, you will lay this sheet with the absorbent side up over under the patient, right? Same thing. And then if it's a male, you'll lay this pad over their genitals, but today you can use female right now. Here's a another sterile gloves in this package. I already have it on, so don't need it. And then here is a lubricant for the catheter, a syringe for it's just saline water inside here to blow up the balloon. Get something away because my table isn't that big, right? sterilely between the patient, their cup for getting samples. Don't eat that. And this is the catheter, and here's a drainage bag, right? So what you do, same thing. Get this cath out. You would get a sterile gloves on, didn't touch anything unsterile, and you would lubricate the catheter, right? Same thing. As you can see, you can't tell, this is the balloon that will blow up. I'm gonna show you like closer later, but yeah, you can see it's thicker. There's a balloon area here, right? And then here's a valve. I'm going to pop this open. It's just saline water. This is just for blowing up the balloon. Of course, we're not going to blow it now. We're only going to blow it up when they're in the patient. I'm just going to attach it to the valve right now. And then same thing, you would clean the patient. Where's my butter ball? You clean the patient. For now, it's a female, so again, I would open their labia minora, and then clean the other side, and then straight down, right? And then you won't use the left hand. You don't let it go, because it will recontaminate, right? And then you would gently slide it into the urethra for 3 inches, 3 to 5, and then if you see urine, keep going. Only for Foley, you would go a little bit more, 2 inches more, just to make sure you're really in there, so you can blow up the balloon a little bit better. I will let you see how this would be blow up. So you see, I'm holding the syringe, and I'm gonna push it in, push the saline in, and you can see inside the balloon blows up. Can you see it? And then I can let it go, and then I'm still compressing, because if I like let go, it would like start pressure would go back up to the syringe, so I have to like keep pressing it down so the balloon won't deflate. But yeah, so you can see here the balloon is blow up, and then when you blow up the balloon, you tug it down to the bottom to make sure it's secure, right? This is what a Foley indwelling catheter does. It helps you put the catheter inside your body and then hold it there so it wouldn't like come out and like leak out, right? See this? Tuck it down. This is the same for male and female. You see, it's the same thing. With straight calf and Foley, it's the same. So, I don't know how it feels for a male to be blown up this big inside their urethra. I don't think that's comfortable, but you know, you gotta do what you gotta do. And then once it's secured, you would you strap the tube to a lick strap, so like when this string is this tube is actually pulled, it wouldn't like pull your Foley. You strap it on your leg. I don't have the strap right now, but you'll have a strap and like strap this area on your leg, so like they wouldn't pull your catheter, right? And then this is the drainage bag, and I can open it for you to see. But yes, this is the Foley drainage bag. You would hook this bag to the side of the bed that doesn't move, and this one is the tube that you can drain from. You can pull this out, and you can just pull this plug. Hold on. Come on. There we go. So here's like a switch button. You just have to like press this, and then come on. And then urine would flow out, so you can empty this bag here. You can measure it, then you just have to close it and then clean it. You just put it back in here. It's kind of hard to put this back in. Hold on. There we go. Yep. That is fully catheter. I need to deflate this to get this out of my water bottle. I literally, before this stream, I had to go downstairs, get a water bottle, and pour water into my other water bottle for this demonstration. I'm not kidding. I'm grateful that I can still pee myself. Yes, be grateful that you're healthy and you don't need help to pee. Where is my syringe? There we go. But yeah, when you get it out, just have to place the syringe in and just pull the water back out. Yeah, I'm gonna hold it a little longer so it would probably get a little bit more of the water out of the calf. Come on. Alright. Come on. Takes a while. It's a little bit in there. That's okay. That's okay. Alright. Yeah, that's the Foley. Do you have any questions? You feel alright? After I put a Foley inside you? You feel alright, buddy? You're fine. You're fine. Questions? Where's my things? Is it educational? I hope I didn't miss anything. I think I did. Let's see, what are we gonna do next? We could do injections. I need to get my injection pad. I'm not really good at med right now. I panic a lot when I try to do med. Educational and painful. No, it's not painful. I lubricated the catheter properly. It shouldn't be painful. Hold on. Hard to get it back in. It's hard to get it back in my... There we go. I got it back. Hold on. Packing this back up is also a hassle. Oh! Listen. This is a pain in the ass to get it back in this goddamn box. Come on. There we go. What is that? Oh. You guys have anything planned for Valentine's Day? And breaking character, yes. If you don't, well, today is Valentine's Day, so I guess your plan is watching me practice things on you. But if tonight HKT or tomorrow for US morning, if you don't have anything to do, I'm probably gonna stream Repo Company with those guys. I've already classified them as those guys. I don't need to explain. Sterile gloves. Did I miss anything? And yes, I'm wearing scrubs today.
ウィキさんいらっしゃいませ。こんにちは。大丈夫な問題皆さんいらっしゃいませ。こんにちは。我哋今日情人節，我會用觀眾嚟你哋嚟練習。係
Dummy, right here. It's me. Sorry. I'm trying to pack things up. There's a lot of things. But it was interesting when I first, see what the balloon looks like when it's blow up. I didn't know it would blow up that big. And it's inside you. It's inside your urethra. Isn't that crazy? I can't put this back in. It's fine. I'll put it back in later. Oh my god, everything is everywhere. Amazing. Okay. Pack this back up. I'll prep for another thing, which is injection. We can do injections. I need sterile gloves for injection as well. I'm too lazy to put it back in. Meds. Oh, I should print out my med chart, my med order, so you can see what a med order would look like. Well, it wouldn't look like that. That was just for practice, but I can show you examples of a medical order. Hold on, my fucking PPE is... My PPE is falling apart. Why am I even wearing a PPE today? I'm like, ooh, what if I wear a PPE as well? There's a lot of circumstances where you have to wear PPE, protective personal equipment thingy. Yes, protective personal equipment. If you have to wear a gown, gloves, mask, it depends if your patient is highly infectious and those infections are airborne, then you have to wear an N95, which I have it somewhere. Where the fuck is it? I don't know where it is. But yeah. But for PPE, this, the gown, the gloves, the mask, you have to wear it for a lot of reasons, for some infectious patients that you would touch droplets of and transport it by touch, inanimate objects, anything. A lot of times I have to wear this because I'm going into a C. diff patient's room. C. diff, which is transported by feces. But why it was easily spread is because it was in the hospital setting. So after someone contacted a C. diff patient. Maybe they didn't wash their hands properly, so they touched another patient, and they got C. diff. And C. diff, you will have very liquid diarrhea. That's why a lot of times they need to get a ostomy, a colonostomy, to help them defecate in a ostomy bag. And it does smell pleasant. It smells very distinct. It does not smell pleasant. So that's why hospitals need to make sure their staff actually wash their hands with soap and water after going into a C. diff patient's room. Yeah. Okay, dosage. I don't know if I'm going to do calculation today. Dosage calc today. I'll do it on my own, but I'm just going to demonstrate and like generally how to prepare med. I'm going to get this off, actually. Do I need to? No. I'll get stuff ready. Give me a second. Okay. Give me a second, okay? I don't know. Look at this or something. Hello, lại lấy ta arm à. Hello, game game打針㗎. Hello, game game打針㗎. This is my injection pad. There's a little liquid inside. Look at it. Yeah, hold on. This is you don't need to open your legs anymore. Well, I have to do ostomy later. It's fine. But yes. Injection pad right here. You 可愛嘅護士妹妹應該唔驚。唔驚？好，你話㗎。I can do the easiest thing first, which is insulin. Now I'll demonstrate using a saline. Well, all of our thingies, all of our meds we have in the practice room is not actually meds, because who the fuck would waste meds? So it would just be in a bottle and would be labeled as different meds. Like, where's I have my paper? Oopsies. Where is it? It's hard to use gloves with my iPad. But yeah, they would just label stuff like dioxin, heparin, whatever, warfarin. No, that's just warfarin is just like oral med. What is it? Saline or whatever. Insulin. But yeah, all of the little meds we use to practice, it's just water. We just use water. But yes, pretend this is insulin. So for insulin, insulin can be also you can inject insulin to yourself as a patient, so it's pretty easy to remember. Giving insulin, you have to be careful not to give too much or too less, especially for patient with who is diabetic. That's why for insulin, we only use 1 unit, which is units. Exactly. They have a special unit. They just have units for insulin. Can you focus, please? Please? It's not focusing. Come on. Yes, it's for controlling diabetes. It's for diabetic patients. I can't fucking... It's fine. You can't see it, it's fine, but it says units right here. So you only give patients in units. You get your order in units, and you give your patient in a syringe, insulin syringe. This is, it literally says insulin syringe on here. So you only give insulin in a insulin syringe, and you also only use units when it's ordered, and when it's also when you're also like getting your insulin out. So see, syringe right here, the needle. And I shouldn't get this out first. I just want to show it to you. Also, when you have to recap a needle, a clean needle, if it's dirty, if it's been into someone, do not recap it. Just fucking throw it away. But yeah, when you have to recap it, you have to like slide it back in, set a cap so you won't like poke yourself, right? All right. So you would do your med check. We would do 3 med checks. You would make sure your order is patient curry fishbowl. Neat insulin. Let me see. How many? 10 units. Okay, 10 units ordered. Let me see where it says. Subcutaneous, which is actually, let me just read it out loud. Subcutaneous means it's at the like the fatty layer of your skin, under your skin. Is administered into the epidermis tissue layer. So it's the fatty layer. This way of injection is slow and sustained, so it's like steadily seeps into your body, and you do it in like a 45-degree injection. I think you can also do it at 90 degrees as well, but most people do it, they'll like pinch your skin and then do it in like a 45-degree to get into your adipose layer. Yeah. And yeah, for insulin syringe, it is mostly sub-Q, and you would inject this in either like your arm, which is like your shoulder-ish place, like here, fatty tissue over here, your thigh. Let me make sure I'm saying this right. Yes, your upper arm, your abdomen. A lot of people would do it on their abdomen, mostly on the fatty area in the lower area of your stomach. 2 inches or like 3 fingers below your belly button, and then you just like pinch it and then inject that needle. Thigh, it could be upper back area, or the dorsal gluteal area, which is your ass. So yes, you can use, if it's subcutaneous, then you can use it on all these areas, right? And then after you check your meds, your dosage, if it's the expiration rate is not, this is not expired. What else do you check? Patient, round, subcutaneous, patient, tray fishbowl, time, it's due right now. It's a med, 10 units of insulin. Yeah, that should be it for insulin. Insulin is pretty easy. And then you will start, you will have to draw it out. So, oops. And when it's a vial like this, you'll have to, this is protective wipe. This is not alcohol wipe. Pretend this is alcohol wipe. You have to like wipe this area to keep it sterile. Then I would draw up how many, this is just air. Draw up to how many you want. So I draw up like 10 units right there. And I'm going to push this air. Well, I'm going to stab it in here. Come on. And then you're gonna push this air back into the vial so it wouldn't like explode, decompress. And then you'll draw to what you need. I'll always like draw more than I need because sometimes the air bubble gets in the way, so I'll draw a little bit more than I need. And then I just realized you can really see. Damn, that's okay. But I draw a little bit more than I need, and then I just pull it out back out. And then the excess ones you can just like you literally just like push it out. I need tissues. Hold on. It's okay if you draw too much. You just have to push it back out to where you need it. There's some bubbles. Let me just... Give me a sec. There's bubbles. Fuck. Come on. You can do it. Get it out. Hold on. I'm gonna bang it on the table. Come on! These air bubbles piss me off. I can't get it out. I'm trying to flick it. Sometimes they bang it on the table. My teacher just bang it on the table and it works somehow. Okay. I pushed the bubble out. Alright. 10 units of insulin. Wait, is there bubbles? No, it's just water. Good. And then I'll recap it. And then if I have tape, I don't have tape right now, but I would write on the tape and write the medication name, the dose, the route, and tape it here, and then do my med check again. Before I go to my patient, I do my med check again because it's important. If you give the wrong med, your patient is gonna die, you know, stuff like that. But yeah, you have your ready, go to your patient, right? And then you explain your procedure, what you're gonna do. You're gonna inject insulin, and you prep the skin. You're gonna use protective wipes for the skin, and like wipe the layer. I'm not gonna get this out. I don't want to waste it. And then you get your syringe. This is subcutaneous, so you have to pinch the skin to get that fatty layer out, and then do it at a 45-degree angle, and then just push in, and then inject, and then out, just like that. Normally, for my exam, I don't have to use gauze, but they would like. Normally you'll use gauze to press on the area and then tape it over or like bandage it over. And then yeah, that's how you do it. With injection, with insulin, subcutaneously. Yay! Wow. Injection. Let me see. Can I not put this back in? Every time once I put this out, I can't fucking put it back in. Yep. It's stuck. Alright, that is insulin. But I can do other things. Let me see. Let me get a order sheet. So I can give examples. Let me see. Why is so much people looking at me? There's a lot of you guys today watching me inject stuff into you. Anyways, let's try another med that can push in intramuscularly? IM. Actually, what happens if there was bubble inside the syringe during the injection? That's a great question. So, when there's bubbles inside your syringe, the bubble, well, if it's really small, it shouldn't matter. Like really, really tiny bubbles, that's fine, right? But if it's like big bubbles, it could cause problems. Like it could be stuck in your vein, your vessels, your blood vessels, and something would happen. It's called, I forgot. How do you say that word? Air embolism. Yes, air embolism. So it could cause, when it's stuck in your blood vessels, it could cause stroke, heart attack, or like respiratory failure, heart failure. But yeah, it's not good. It's sometimes it does nothing. Your body just fixes itself. It just like get the air out. But if it's too much bubbles, then yeah, you could have a stroke, a heart attack, or respiratory failure. Yay! That's why you have to flick the bubble out for any injection. Air embolism. That's what it's called. I can't turn on my phone. Uh-oh. There we go. Air embolism. Yep. Let me see. Next thing. I'll do a intramuscular injection. I can maybe also demonstrate some MetMath. So, let's do. Diazepam. So I got my order, diazepam, Q 3 to 4 hours. That means like you have to take it every 3 to 4 hours. For PRN, so it's 4, is moderate anxiety. Doses 4 milligrams order, and then is injected intramuscular in the deltoid area. Deltoid? No. Which one is this one? Ventrogluteal area. Alright. So, do I not have a syringe? How much is this? It's 1 cc. Do I have 5? Okay. I do have a 5 cc syringe. Thank God. 5 cc syringe. Pretend this is diazepam, and the med it says is 4 milligrams of diazepam per 2 ml. So I would have to get 2 ml of diazepam for 1 injection, right? Math. And then I don't need a filter needle. It's fine. Do I have a normal ass needle? Where's my needles? Is this filtered? Yep. Nope. Not that one. Is this blunt filled? Nope. Where the fuck are my needles? Where's my... Oh, I found it. This is 1.5. So for intermedial, you can always use 1.5-inch needles, which is great. Is it also, oh, that's blunt filled. Yes, this is a 1.5-inch needle for intramuscular. But there's intermedial. I mean intramuscular. Later, if you have to inject it. So, like the name, you inject it into the muscle, which is way faster. The med works way faster, and you inject it at a 90-degree angle. So just like, just straight down, right? That's why the needle is longer, because you need to get down to the muscle, not just the subcutaneous layer. You have to go into the muscle and inject it into the muscle, right? So it's long, kind of scary when you see it, very long, and also it hurts if you don't have the skills. Sometimes even you have skills, it hurts for intermuscular. But yeah, this med, I have to draw 2 milliliters. Right, so I'll get my syringe out. This is 5cc because we need 2 milliliters, so that's good. And then I'll just have to, I think you can use a blunt filled needle to fill it up first and then change it. Should I can do it. I'll use a blunt filled. So this is blunt filled needle, and this is used for like just getting the meds into the syringe. Maybe you need to like mix the meds, dilute it or something, so you can use a blunt filled like that. Just demonstrating, but you can tell, oh, you can't really see on the screen, but it's like blunt, so you can't inject this to someone's body. This is just for filling the needle up, not for injection, right? So the same thing, I need 2 milliliters, so I push it to 2 milliliters of air into the vial. Come on. Some of these blunt ones are hard to push it in. And then turn it around, push those bubbles in, then fill it. A little bit more than I need, in case I don't have enough. Alright. And then I'll push the med out. I'll push the airs out to what I need. Come on, come on. Push the air out. Flick those bubbles away. Sorry, I'm banging on the table to get those bubbles out. No bubbles, no bubbles, no bubbles. You can't really tell. Sorry, I have a shitty camera. But yes, no bubbles. This is good. This is 2 milliliters of what is it called? God, these medicine names I do not remember. Next semester I have to do pharm, and I'm so cooked. Diazepam, yes, diazepam. And then to recap it, there's a blunt fill, so I don't need it anymore. I'm going to, I'll throw it away. Well, I'm not really gonna throw it away, but I'm going to change to a injection needle. Twist that back in. This is a 1.5 inch injection needle, right? Away. And then you get a tape, write down your med, your dosage, your route, which is intermuscular in the ventrogluteal. Diazepam, what is it? I don't fucking know. It is for moderate anxiety. I haven't learned med yet. I haven't learned pharmacy yet, so I don't really know very specifically what these med means, but in my order it says for moderate anxiety. It's for anxiety. But yes, write down med, what it's for, dosage, route on a tape, and tape it around here, so when you get to the patient you can check it again, check the med again, check your order again, make sure you get the right med, right? And let me explain what is ventrogluteal. So for intermuscular injections, there is mainly 3 sites. 4, it could be 4, but we don't use your ass anymore. We don't use your gluteal anymore. Some places still does it, but now we just do 3 different ones mainly. One is ventrogluteal, which is let me show you. ventrogluteal would be the side of your hip, and how you find that area on your ventrogluteal for your intramuscular injection. You would put your palm against their thigh. Your thumb would point to their groin, and then your pointer finger would be on their anterior superior iliac spine, and then your middle finger would be your posterior iliac crest, pressing over there, and then your injection site should be between your pointer finger and your middle finger. But yeah, basically you press these fingers on your bone, your iliac crest, and then that is the site where you would do your injection. So put it here. Get my skin prepped. Get my injection. Out. It's really long because it's for intramuscular. You really gotta get into the muscles. Then I'll find the area right there. Now kind of just. I'll probably not, like, you know where the area is. You don't really have to put your finger there because that's dangerous. You don't want to stab yourself. But you know where the area is and just stab it in. Push it down. And go back out. There we go. This one here, it's a safety. So you can, like, if you don't want to stab yourself, you can just, like, bang on the table and it would, like, close up on itself. It would click and then it would close up on itself, so you won't re-inject this needle. It'll keep you from injecting to another patient or injecting yourself accidentally. But for now, this is for practice, so I'm just gonna come on, get in. I'm gonna recap it. But yeah, there's also 2 other sites I can talk about for intramuscular. One of them, the one we do on the side of your hip, is ventrogluteal, and the other sites, one is vastus lataris, which is the side of your thigh, right there. So what you will do is to look at your thigh and, like, imagine it in 3 sections on your vastus lataris. So, like, you imagine this, and then imagine 3 sections, and then the middle section is where you would inject it, your muscle. Outer, middle, third. The outer side of your third. So, kind of like this area, and then you also inject it 90 degrees, just like that. Inject it. You could also inject intramuscular areas. Other intramuscular areas, well, sometimes they would order you, like, specifically in what area, like my order did, but some orders you can inject it to any 3 site. The 3rd site is the deltoid area. Deltoid, which is on your shoulder, the below your shoulder. So you'll be your shoulder, and then you'll have 3 fingers down your shoulder. It's kind of where your injection site is. Like, make a little triangle from your clavicle. Just like a little triangle. I can't really explain it. It's just like 3 fingers down your shoulder. That would be your deltoid area. Right here. And then just, like, do it 90 degrees. Boop. And then inject it. Kind of like that. Marcus told in my Indian lecture. I'm very bad at explaining this. I am a student. Remember, I am not a trained professional. I am not a professional. I am not a professional. I am not a professional. I'm just a student. Do not trust everything I say. Please. And also, don't do it on someone else. Do not trust everything I say. I'm a student. I could be wrong. I'm not a professional. Don't do this. Don't do this to other people. I hope you don't have needles to stick it in other people. I'm also not going to stick these needles in other people. This is just for practice. just for practice. Do not trust everything I say. I'm wrong. I could be wrong. Yeah. We could also give, for practice, we give like oral meds. They're just like little med looking thing, and sometimes we can split it in half because they're not taking the whole med. Yeah. That is the gist of injection. Dosage calculation and like the med prep. It's kind of scary, but injecting it is not really scary because you're not doing it in a real person. You're just doing injection pad. If I have to actually inject it into someone, I'll be fucking terrified, which I might have to do next month. That is med injections. Yay! 戴頭盔成100係，咁我真係我真係唔係專業，我唔係專業人士，我冇牌，只係學生，我只係一個學生，所以大家唔好信晒我講嘅嘢，同埋亦都唔好家庭觀眾唔好做我做緊啲乜嘢，呢啲只係用嚟練習嘅道具，你唔好真係攞啲針筒去插其他人啊。Only for medical professionals. Ah, shit. These things are hard to do. Next thing is wound care, which, it's kind of hard to do it on someone. Do I have okay, I need a bowl and stuff. Hold on. So next thing is wound care. I'll do like a suture wound first, like a thigh incision, right? Pretend I have an incision on my thigh. And I will have to prepare a bunch of stuff. Saline. Everything is falling apart. Amazing. In my room, I only have one bowl right now, which is the Crimson Rose bowl. Look at this, so cute. Look at this Crimson Rose bowl. Look at the roseters. Look at it, so cute. Anyways, I'm gonna use this as a bowl to hold saline. My fucking phone died. I thought it's charged. Wow, it's not charged. Haha. God, you better fucking charge. Charge. Come on. No. The syringe and different needles or info is quite informative. Yeah. I hope you're less scared. Well, I think I just made it scarier because I said intermuscular ones hurt. Because needle long, it's inside your muscle. So any little movement, it hurts. Yay! But it wouldn't hurt that much. Don't worry about it. I said intermuscular, you can use 1.5 inch needle, but you can also use 1 inch needle for ventrogluteal and deltoid. But for vastus lateralis, you need at least 5/8 inch needles. 5 or 8 inch needles. Yeah. What else? Also, I didn't mention this. For injections, when you're prepping the injection, when you're prepping the med, you don't need to wear your gloves at all. You can just use bare hands to prep your medication, and you only have to wear like normal gloves. You don't have to wear sterile gloves for your for injection. What the fuck is wrong with my phone? What the fuck is wrong with my phone? Not working. I'm gonna use my power bank. By the way, I'm standing up right now. I'm not sitting, I'm standing up to do my demonstration. So, some of my wires can't really reach my table because I'm standing up. Yes, I have a stand-up table. Alright. Come on. Don't do me like this. I have so many wires. Alright, okay. Let me prep this bowl. I don't have like a pad for this, because usually there's like a pad and there's like cotton underneath in case like something is soaked, you know, for the sterile field. But right now I'm just using this. Okay, this bowl. I need gauze. Ah yes, gauze that I have reused. It's fucking opened. Yes. 1, 2, 3. Only 3 for this. 3. Gauze. Pretend this is saline. Gauze. I don't need. I don't have an ABD pad. Fuck. I don't have an ABD pad. I should have stole one in the lab. That's okay. We can pretend one of the gauze is an ABD pad. I also don't have tape. I don't want to actually use tape. Anyways, this is just for demonstration. It's fine. I don't have the actual materials, that's fine. I just have to kind of talk about it. Okay, so what you do for patient with any wound, for example, right now, a thigh suture, right? So you go in with your normal gloves, not sterile gloves, and then you'll undo their dressing, and then look at their wound, their incision. Is there any drainage, redness, anything weird, bruise, whatever? Note that, and then you would go set up your sterile field on the table next to them. So same thing, opening the sterile field. Where is the silk? What silk? Silk song? If my friend needs injection, I will follow this. Do not do that. Do not listen to me. Do not listen to me for anything. This is just what I'm practicing. I'm just practicing. I'm not giving any information. You don't listen to me. Don't listen to me. This is how I do it. Well, okay. So, again, you'll open your sterile field, only touching the 1-inch border because you don't have sterile gloves. And I would also, hold on. I have so many things on my table. I will push this bowl. Well, this is fucking paper, and this bowl is like, is this I don't know what it's called. Pochi? I don't know. So, usually this bowl is plastic. The bowl for your saline. And then you will like go under the sterile field and like slowly push it to the corner so it can pour the saline without like going over the sterile field, right? So you would like go under and push it to the edge right here, right? You push it to the edge. Oops, I crushed curry. and then so you can, on the edge, you can pour your saline into the bowl, right? And when you don't have your sterile gloves on, you try not to like reach over, do anything in the sterile field, or you'll contaminate it, right? Also, you can't turn your back towards a sterile field because you don't know if something like fall on your sterile field to contaminate it, so you always have to face yourself towards the sterile field so it's not contaminated. Oops. Can I use my VTube Studio now? Phone, please. Phone. Okay. So, I'm gonna show you next is how I have to like put these gauze to my sterile field. It's really weird. Let me adjust the camera so I can show you a little bit. Yes, I'm in my PPE. Look. So, I'll push this down a little bit so I can see better. So this is my sterile field, right? And you try not to like have anything over it or on it especially. So what you do when you open your gauze outside of sterile field, honestly, hold on. I'm going to angle myself a little bit higher. Don't look at the background, don't look at the floor. It's really dirty. I have a lot of shit on my floor. But yeah, you will open your gauze and then you try to go outside your sterile field and then just like throw it on the sterile field. Open it? Okay, I can show it closer, right? So I would like do this outside the sterile field and it's pop it off. You pop off. You literally pop off the fucking gauze in there. And you would open it, pop it. They literally do this. It's so funny, but it does. If you like go over the sterile field, you don't use it. Right? Okay, that would be my ABD pad. Good. You have everything. You will also prepare like your bandage tapes. So you would like get it on the table, write down the time, date you put the dressing on, and also your name and signature to know who put those dressing on, right? And then you'll finally put on your sterile gloves, which I already have on, and then you can finally work in your sterile area. So I need 3 gauze in saline to clean the wound. So I'll put them in there. And then pretend this is not the sterile area. Well, it's fine. And then you'll pick up one of your gauze and then you'll start cleaning on the incision first. On the wound first. So incision like that. You throw that away. Another gauze, and then if it's a thigh suture, there's like an up and down. Normally I would like rotate their thigh so it's more like horizontal to me, but there's still like an upper side and a lower side, right? So sometimes the saline will drip down, so they tell us to clean the upper side first. So when the saline drips down, you can clean the bottom side right now. So now it's properly cleaned for the thigh suture. You would have a clean gauze, then patch the wound. Sometimes it's like a long wound, so I would do this. But if it needs more coverage, we'll just like do this, right? Depends on like how big the area is. So you have it like this. And then I don't have an ABD pad right now. I can't show you what it looks like. So it's just like a big bandage. Pretend it's like a big bandage that covers your wound. So like you'll put this over your gauze. Pretend this is an ABD pad, and you'll tape around the ABD pad and tape the tape you have your name, the date and time on, and you should be done. Yep. that is how you put on, you do wound care for suture, or yes, wound. Yay! For, let me see. Boop, boop, boop. On our skill, we also have to do a JP drain wound care. So what a JP drain is kind of like a it's not an ostomy, because ostomy is like a surgeon surgically made a hole from your body to like get any drainage out. But for JP drain, it drains from your organ from the inside. Let me see. JP drain. Basically, after surgery, you might have a lot of drainage, right? So a JP drain, it's like a little bag, it's just this small, and it's compressed, so like the drain could like, so the pressure would let the drainage get into the little the JP drain, what is it called? The drainage bag, yes. But yeah, it's gonna be, there's a tube inside your body that it drains from your wound. It could be an organ or anything, but yeah, it would mostly be for after surgery, where your body has some drainage. It could be reddish, brownish, I've seen. Yeah. And sometimes there would be an incision wound next to the JP drain. So you have to change the dressing and clean it. Yep. Let me see. And yes, you have to empty it, like the ostomy as well. So I don't have that set up. I don't have like I can't show you visually what a JP drain looks like, or what the incision looks like, but mostly it's either going to be on your chest or abdomen. Mostly going to be in your abdomen. Pretend there's like an incision, and then like the drain is over right here. So you do the same thing with setting up your sterile field. Maybe you need a bit more gauze. You need a split gauze. A split gauze is basically gauze, but there's like a little slit right here, so you can like, the split can go around the JP drain where the tube is sticking out, right? So it wouldn't like slide over or messed up where the tube is, right? So you do the same thing. You would like have gauze with saline damped, and then you'll first clean the incision, clean it the side away from the JP drain, and clean it the side where the JP drain is, and then you'll clean away from where the tube is for the JP drain side where the tube is coming from. You cleaned up, and the drain is like dripping like down here, right? So you have to use another gauze to kind of do I have a hold on, I want to have something for you to visualize. Let me just get something. So pretend this is the tubing for the JP drain, right? It's like right here. So you clean like above it where the JP drain is coming from, and then you have to like lift up the tube with another gauze or like a cotton swab, and then you have to like clean where the tube is lying. Then put it down, and yeah, that's like the JP drain. Is JP drain like most commonly seen drain in ward setting, like a psych ward? It's mostly after surgery, you need it after surgery to drain from your wounds. Do I have anything else? Wound, GP drain, suture wound. Oh, I can like talk about ostomy care. Let me just put these away. My room is so messy because of this fucking stream. I'll put these gauze back later. So, an ostomy is surprisingly not a sterile, it's not a sterile skill for some fucking reason. I guess it's fine. It's not sterile, but I can show you an ostomy bag. So, this is an ostomy bag, right? So, usually it's for draining feces, so like colonostomy. It could be from your bladder, ureostomy, so it could drain urine as well. But most of the time, it's draining feces, like liquid feces. So, there will be a stoma on the patient, which is gonna like really red or pinkish little thingy, little flesh right there. Your patient is not gonna feel anything. Like the stoma doesn't feel like anything, so don't worry. Because it's inside your body, so you can't feel anything inside your body, like your organs or anything. So there'll be stoma, and then there probably already is a ostomy bag on there, right? You have to like if you have to, this ostomy bag is like a non-reusable bag, right? Because there's no drain hole right here. I don't know why this one is like a one-time use one, but if there's one that you have to change, then this will be it. You'll have to like take this off and then throw it away, and you get a new one. You'll first prep the skin, so you use like your wipes to wipe around the stoma, right? Have a pad underneath the patient because there might be feces or like urine draining out from the stoma, so have a pad under them for collection. Yeah, it can be, well, not what I mean, like a what is it called, like an ostomy that can stay on your body, because there's like usually what you see in the hospital is a ostomy bag that has a tube for drainage, so you can empty it out and just like keep it on the patient, because if you have to like reapply it and like rip it, reapply and rip it, it would cause irritation to the skin. That's why normally hospital would use a long what is it called, not indwelling, but you know, an ostomy bag that can stay on your body for like a week or like a few days, so you don't have to stick it and reapply it to irritate the skin around the stoma, because it's really sensitive. And sometimes the stoma would have a little bit of blood because it is a wound, kind of. It is your organ, so it would bleed. Sometimes a little bit is fine. That's why you have to clean it before you apply a new ostomy bag. And stomas sometimes different in size. That's why there is these instructions. So there's like a little sheet where you can like go over the patient to see how big is their stoma. There's like a little measurement tool to measure how big your patient's stoma is. And after you measure it, you can see there's like little lines. This is 30 millimeters. So if your patient has a stoma a little bit smaller than 30 millimeters, then you can cut it. Like you can start going through this line and then cut it open like that. Even if your cutting is not great and it's a little jagged, this is like rubbery and easily moldable material, so you can like kind of use your finger and your heat to smooth out the area, even if you like cut it not very nicely. But yeah, you can cut this to however the stoma size is, and then you just get this tape, get this like little layer, rip it out so we could stick it on the patient, on the stoma, like that. Yep, that is an ostomy bag. Yay! Let me see. Isn't it for storing poop? Yes, it is storing specifically liquid feces, because if it's solid, you can't really like pour it out. But yeah, it's gonna be liquid poop. It's gonna be diarrhea. But it's already like, it's from your like either colon or like small intestine, so it's gonna be liquid. It's just gonna pour out like in a more liquid form, right? Yes, that is. I think that is ostomy. Did I miss anything? Ostomy. And clean it around, measure, cut out, put it on. Yeah, that's kind of it. Oh, this is a clip. Sometimes you might have to like clip around it, like you might have to like clip around the area, so like your drainage won't spill out, and then pull it off. I don't know, they didn't really use the ostomy clip thing, or like you use it to like push out the drainage from to the bottom of the bag so it can drain it out. Stuff like that. Yay, I think that is it. Well, I can show you another thing for taking out med. Hold on. Let me get my drainage pad back again. Where is it? Where is it? Sometimes chat is so quiet today. I don't know. I see a lot of people here watching me, but you guys are not talking and it's scaring me. I think it's because you guys don't know what to say, or like you guys are really like I don't know, you're just really into this or something. But sometimes I want to show you medications comes in a ampule. Yes, so sometimes this comes in an ampule like this, right? 我太專業，我真係認真，我真係要我下個禮拜要考試，所以我真係認真練習緊。呢度係咪我太專業啊？大家今日係太認真啦。But yes, sometimes it comes in an ampule like this, right? So this is do people actually can people actually flick this and then like it broke? We don't do that. We don't actually fucking flick it and then make it break. We just kind of like pop it open. But yes, this is a glass ampule right here. and you have to break this thing in order to get the med inside. And let me ask you guys, do you think there's gonna be glass flying out or like flying inside the meds when I break it? There's gonna be some glass. Even though like it's really tiny, we can't see it, there is gonna be glass that spills out, correct? So that's why when we draw from an ampule, we always need to use a filter needle. So we can filter everything out, like filter the tiniest piece of glass out, right? I can show you that. Oh, these are scary. I'm always scared to open my ampules out. So I have my filter needle right here. And I also have my injection needle and my syringe, right? So this is 5 milliliters. Okay. Where's my other thing? Where is it? It's fine. I don't know where I put it. Alright. Alcohol wipe. So what you would do first for an ampule, what content are they usually filled with, or it varies? It varies, but I think like some department has more ampules. But nowadays, like more commonly now, they don't really use ampules as much because 1, it's dangerous, it's glass. 2, you don't know if the glass is properly filtered out. There's too much risk on ampule. That's why now we have more like vial medication instead of ampules. It's too there's a lot of risk to it, so we're not really using this too much, but you will see them. So some specific medications there will be. I'm not sure what, but there varies, I think.
天さんいらっしゃいませ、こんにちは。
Vial is safe, of course. Yeah, vials is way safer. So, but you will encounter ampule, different things. Vaccines. I think vaccines now. Yeah, some vaccines still use ampule. But yeah, a lot of vaccines do use ampule, but yeah. You'll have to encounter it anyways, someday. So, what you would do is I'm going to sacrifice this alcohol wipe. So, what you do, of course, you have to clean the ampule, right? To clean it. And then you'll use like package. You can either use like your alcohol wipe to do it, or your package, what I usually do. And then you'll see like there's like a little dot right here to indicate where you would break it, right? So you'll go over the dot, and then you kind of like, you have to like remember to break it away from you, so like the glass will flick away. So I'll like, this one is hard. Ooh. Oh, it's because the alcohol is slipping away, not really gripping it right. Oh my god. I shouldn't put too much alcohol on this thing. It's not slipping. It's fucking slipping away from me. Let me clean it. There's too much alcohol on here. Oh my god, this one is really hard to break for no reason. Usually this breaks pretty easily for me. What the fuck? Different hand? Nope. Nope. What the fuck? It broke. It broke my fucking... Can't imagine people really fucking up a finger. I do not recommend people doing that. Oh! I did it. You see it? I think I flicked glass on my fucking computer. I don't know what I flicked. I flicked glass somewhere on my table. I have to clean later. But yes, you see it just kind of like pops off right there. Say a little while. I need to throw this away carefully. Jesus. I realize my house doesn't have a sharps container. Oh, I just flicked liquid on my computer. That's fine. But yes, this is popped off pretty clean, a little jagged. But I popped off the ampule like this. And you'll throw this into the sharps container. I do not have one right now. I'm gonna put it on the table. But be careful, it's glass. It's glass. Careful. Yes, put it here. And then I'm gonna put my filter needle. I'll do 1.5. There's some liquid in here. It's fine. Yeah, I'll do 1.5 milliliters. And I'll just like go straight down and oh. You don't have to put air into this, by the way. Hold on, there's some liquid in here. Alright, so for an ampule, it's not a vial, so you don't have to like get air, because this is already like opened, right? There's no like pressure like a vial, so you don't have to like draw out air and push it back in, so the pressure can I don't know how to say it, but the pressure won't like go back down or something. I don't know how to explain pressure. But anyways, you don't have to like push the air back in to like a vial. You just have to go straight down and then pull it back up. And just to pull everything from the vial, from the ampule, like that. Let's pull up. And then I'll just push the air out. And the medicine I don't need out. Almost stopped myself. Get those bubbles out. I only need 3. I only need 1.5. I can push some of them out. Get those bubbles out. Even the tiny ones. Push some of the med out. Yeah, no. I can't explain. Like, you need a little bit of air to go in to the vial first, because it's like contained. So if you don't have air inside, there's no way for the air to go. So that's why we need to like press to like push some air into the vial first before you draw it back. Draw back the meds. I don't understand. I don't know how to explain it. Fucking physics. Whatever. Anyways, I got my 1.5 milliliters of... What the fuck is this? No idea. Training use only. Practice ampule. Wow. It doesn't even give me like a med name. So I got this out. I using a filter needle, right? And I will recap this. And I of course won't use a filter needle for a patient. So I would twist it out, dump in a sharps container, and then I would switch to a injection needle, right? Tape it, label it, check your med checks. You have to use your ampoule for the med check. Make sure it is right med, right amount of dosage, and the right site. This is IM. And then you'll prep the skin with wipe. And then needle out. And IM, you go straight down, press, and then go back straight up. And then you're done. But yeah. I just want to show you guys the ampule, what the ampule looks like. Oh. Hello? You good, needle? Okay, good. Yay! You push all the content out? Not all of them. I push all the ones that I don't need it. Because I don't need that much. I get up everything from the ampule because sometimes it's barely enough, so I just draw everything and then just push the thing, the rest of it out. The rest I don't need it out. Yeah, you kind of just push it out. Don't worry about it. It's not gonna kill you if you touch the fucking meds. Probably. I think. But if it's injected into your body by accident, that's not good. Doesn't mean there are always waste medicine when pushing air out. Sometimes you can do the way where you just push, when you can like draw out the perfect amount and just like flick the bubbles out. But I feel like sometimes there's a little bit bubble or like gap between. So that's why I pull a little bit more than I need to make sure I have enough of the med. Just a little bit out. Just a little bit more, you know. To make sure you have enough. Make sure you don't underdose your patients. Yeah. I think I demonstrated mostly everything. There's a vial where you have to mix it, dilute it. So you have to like pull some saline out and then like inject it into a vial where they have like little powder in it, and then you have to like kind of like mix the vial around until the solution is diluted, and then you draw it out with a blunt fill needle, and then you change it. Well, you do the thing with the you draw the saline out and then push it, and then draw it back out with a blunt filled, and then you change to an injection needle, and then give it to a patient. But yeah, that one is annoying because you have to like do a lot of steps. But I don't have that vial, so I can't show you the dilution process. Yeah, that is mostly it for what I've learned so far. I have learned other things, but I don't know how to fucking show you. I can talk about other things I've learned. Let me just get this away. Is this informational? Do you like this? Do you like this Valentine's demonstration? By the way, happy Valentine's Day, everyone. I almost forgot this stream is for Valentine's Day. Wow. This glove is really tight. Ugh. By the way, yes, I am wearing scrubs. I'm wearing scrubs underneath my PPE.
Any questions? Any questions?
I'm gonna wipe my computer. This is Valentine Curry Fishbowl. 知識係 VTuber. Listen, I failed pathology. I'm not very knowledgeable. I failed patho. I'm not good at theory, but I'm good at anything that's hands-on. I'm good at hands-on stuff. I suck at theory. I'm not good at explaining stuff. Let me see. What else can I do? I don't have a live person here, so some of the skills I can't really do. Like ambulating a patient, using a gait belt to like lift them up and like lift them up and then like walk them around. I can't do that. What can I do? Oh, I can show you health assessment. I can show you health assessment stuff. Let me pull up my notes. I'll get my stethoscope. Wearing on oh, I already have PPE on. PPE, you just like wear stuff on without trying not to touch them. I can't use a blood pressure. How the fuck do I do a blood pressure? I don't have a person on me. Ooh, I have to be careful. I wrote my name on this stethoscope. Oops. Oh, thank God. There's a film over it. I can just peel it off. Alright. 呢個咪情人節台咯，唔浪漫咩？好浪漫，我覺得我可以照顧大家幾浪漫嘅。Okay, stethoscope. Wow. What you do with it, you listen not just for the heart, but any part of your body. Give me a sec. My PPE is loosening. Anyways, stethoscope. You wear it this way, so you can see this point towards your nose, like this. Hold on. You would wear it like this. It has to be pointing outwards, right? And then the big one is the diaphragm and the small one is the bell. The diaphragm is to listen to higher pitch sounds, which is like your heart rate, your breathing, and the diaphragm is for listening to lower pitch sounds like any heart murmurs, bruits, stuff like that. Bruits is just like little slosh swooshing sounds, which is abnormal. A little bit of heart murmur is normal for some people. Let me get my stuff. But yeah, if you use your bell and you heard like sloshing, swooshing sounds, that is abnormal. You shouldn't hear that. That means there's turbulence in your blood flow, which means your arteries might be blocked, creating like a flow, like a turbulent in your blood flow, which is bad. You shouldn't hear anything with your bell. But yes. When we usually do assessments for cardiac, we would do a few sites, because when you go to doctors, you would like see them do like you see them like listen to different parts of your body, your back, like that. And for my assessment for cardiac, I'll like the pulse. Carotid pulse is right on your neck. Check that. And you'll also use the bell of your stethoscope to check for any swishing sounds. Your temporal as well. Just check. And for cardiac, for listening to your heart, we listen to 5 areas, which is on your right side, next to your sternum, your aortic area, listen to that heart rate, and then on your left, right across the aortic, would be your pulmonic area, and then a little bit down that would be your Erb's point, and a little bit more down would be your tricuspid area, and right under your nipple would be your mitral. So that 5 area is what doctors or like anyone who try to inspect your cardiac signs would listen to, and they will also try to use a bell to listen for any sloshing sounds to see if your arteries are blocked. And at the same time, they will also tell you to take a deep breath. We didn't do it back yet, but yeah, sometimes, most of the time they would do like listen to your breathing and your heart at the same time, so it's more efficient. Let me see. We will also sometimes check other pulses, like each pulse on your body, your temporal, your carotid, your brachial right here, your okay, I'll just show you here. Your brachial is right here ish. It's like where you draw your blood. You'll feel your brachial pulse. It's really weak. It's kind of hard to feel it, but this is also where you would get your blood pressure from, right? And then your radial, which is under your thumb, right here. You check your radial. What else? Your popliteal. Popliteal is right underneath your popliteal, your knee, underneath your knee. Yes, it's underneath your knee. This one I can barely feel it. Sometimes I can feel it on myself, but most of the time I cannot feel my popliteal pulse. Not everyone can feel it. And there is also they will also check for what areas? Your posterior tibial. Posterior tibial is around. Is it your Is it dorsal pedis? Oh, posterior tibial would be like around. It's really weird because sometimes it goes down to here on your, like, it's around your ankle. Like, you'll have to try to, your inner ankle, yeah. Like, around here. So you really kind of, like, try to feel around to know where your your posterior tibial is, and your dorsal pedis would be around this area on your feet. What about the femoral pulse? Oh, it's like around here, but we usually don't do it because for some people it's uncomfortable. Yeah. For some people it's a little uncomfortable, so we don't have to do it, but we can. If there's if they are concerned on any issues around that area, then you can like try to feel it. Or if there's any accident that you can't take pulse from your arms, your carotids, your temporal, or any area, femoral pulse are pretty accurate, and you can feel it like inside of your thigh. That's why it's kind of embarrassing, a little bit, too close. Some people might be uncomfortable, like me touching those areas, Probably more commonly, pediatrics. Pediatrics, they'll do femoral more. But sometimes they do need to use the femoral pulse. But yeah, there's a lot of pulse on your body that you can palpate from. And for trying to see any cardiac problems, artery blockage, those kind of problems, they will try to feel all your pulses to make sure you're fine. Yeah! Oh, also, I was surprised. So this is I'm talking about my labs. So, funny thing. Well, not very funny. not very funny thing. So your heart usually sounds like lub-dub, 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 like that, right? Lub-dub, lub-dub, lub-dub. So there's only two sounds. We call it S1 and S2. S1 is where it's contracts, and S2 is where it relaxes and fills your heart with blood, right? But heart murmurs is where there's other random fucking noises. S3 noise is what we called Kentucky, because it sounds like 1, 2, 3, 1, 2, 3. 1, 2, 3, 1, 2, 3. And the third one is also really, really soft. So you have to sometimes use the bell of your diaphragm to listen to it. But it would sound like 1, 2, 3, 1, 2, 3. When normally it sounds like 1, 2, 1, 2, 1, 2, 1, 2, 1, 1, 2, 3, 1, 2, 3. Yeah, there would be like an ending sound for the third S3 heart murmur. And sometimes it goes in front of the S1. That is what we call S4. Yes, heart murmur. That's one of the heart murmurs. Sometimes you can hear S3, an extra heart sound, heartbeat for like children. Yeah, so very like children or young adults sometimes have the S3 sound. Kentucky. It is really, really soft. Like the lub-dub is really like the normal lub-dub sound is really loud, but sometimes the third murmur is really soft, so you gotta listen carefully. But yeah, sometimes for children, young adults, you hear the S3 sound. But usually when they when they sit up, they will go away. Sometimes when they lie down, you'll hear the heart murmur. But usually when they sit up, it will go away. Yeah. But even if they sit up, it didn't go away, that would be a little weird. It could mean heart failure, dilated cardiomyopathy, or valvular regurgitation. Regurgitation. I can't fucking speak. But yes, it can also be pregnancy. Sometimes you hear heart murmurs for people with pregnancy. It could be fever, anemia, hypothyroidism for S3. But for S4, which is what we called Tennessee, that is weird. Normally you don't hear that. But it could be present for older adults instead. For after exercise. For all adults, maybe you'll hear like a little murmur like Tennessee. So the S4 sound is before S3. So S3, I literally fucking wrote down the music note. So, if you know beat, if you're musically inclined, let me show you my fucking iPad. Oh! I fucked up my camera. So, iPad. Oh, fuck. No, it's flipped. It's fine. It's flipped. Shit. That's okay. Wait, I can just flip it around. So, you'll go. So, I know it. Don't worry. It's kind of flipped. Don't worry. But for S3, normally it goes lup dup, right? It's just a quarter note. Quarter? No. What is it? 八分音符 4分8分音符係 loop dup, right? But for S3, they will get an extra sound behind S2. So it go loop dup, like that, right? So it'll be Kentucky, loop dup. But the last sound is really soft. The murmurs are always really soft, so you have to listen with the bell. Loop dup. But for S4, it goes in front. It goes in front of the S1 sound. So normally it goes So normally it goes loop dup. But S4 it goes bulup dup. Tennessee. There will be extra sound in front of S1. So it's really hard to differentiate, but yeah. You need to practice a lot to know, is it S1, S3 or S4? But yeah, the fourth one, the S4, it would be in front of S1, S2. Loop dup. Tennessee. S3, behind, Kentucky. S4, Tennessee. I feel like a lot of people might be hard to like try to differentiate them. But if you know beats, if you're musically inclined, you might have a chance. It might be easier. But yeah, that's how you try to differentiate S3, S4 heart murmurs. S3 could be heard for young adults. S4 might be heard from old adults. That young children or young adults, yes, children or young adults could be heard S3. In my class, literally, there's a guy in my class, and they're like, we can hear S3, and I'm like, huh? Is he okay? And our teacher checked, and he's like, it's a little bit, it's like, a little bit of murmur is not that concerning. But he already knows he has that. So I guess it's fine. He's fine. He just has the third sound. He's fine, I guess. But it is really, really, really soft, so I don't know how people like practice a lot to listen to that. Are you gonna teach the heart murmur as well? No, well, I just listened to his heart rate. When everyone heard that guy has a S3 sound, we're like, can I listen to it? Can I try, man? Can I try it? And they're like, sure. And everyone's just trying to listen to his heart rate. I think their heart sound is normal sometimes. I guess so. A little bit is fine if, I don't know. He's fine, I guess. I don't fucking know. But especially for young adults. Well, I don't think they're adults. We're in college. I don't know. But I think he has seen a doctor. And the doctor says he's fine. I don't fucking know. Anyways, but for S4, common things that could be happening to your body, if you have an S4 sound and you're not an old adult that just finished exercising, it could be coronary artery disease, cardiomyopathy, stuff like that. But yeah, it could be heart problems. So that's why we have to listen carefully for heart murmurs, those extra heartbeats. Yay! What else? General survey, nothing. We also check your capillary refill, so we just like press. So when you press on your thumb, you can see, like, you're on your nail, you can see like it's your blood slowly fills back up in like 3 seconds. That means it's normal. Your blood is flowing correctly. When there's pressure, and then when you release it, your blood immediately flows back up. Right? So we will check this capillary refill to check if your blood is flowing properly for your fingertips, but it can also be like other problems. For your it could be blockage, stuff like that. So we will also check for our fingers and our toes, because sometimes for diabetic patients, blood do not flow great on their lower bodies, extremities. Then we gotta check that. We check if the blood is floating down to their toes. Girls doing a full cardiovascular exam. Yeah, sometimes you gotta go through a head-to-toe exam. Yeah. Oh, it is kind of sometimes some doctors don't really like go under your shirt to listen to your heart, which you should. The most accurate thing to listen to, which is skin, like the diaphragm to your skin, you would hear the best sounds. But some doctors just goes like, if a normal checkup, it just goes boop 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 to your clothes. It's a bit embarrassing, or some people might feel uncomfortable for a female when you're listening to the mitral site, which is kind of underneath the nipple. So sometimes with women that are bigger or has like a bigger breast, you have to like go like a little bit under their boob to listen to their mitral sound there. Hair, scalp. Yeah, a lot of times health assessment, you just gotta tell them like, I look into the hair. Their hair has no lice, no fleas. I looked at the nails normal. You gotta just say random shit like, I look at their skin, no rash, no wounds, normal. And you even have to state stuff like they have tattoos and nothing concerning, because some people, if their tattoo artist didn't sterilize their needle, or is not cleaned well, maintained well properly, they might have redness or infection on their tattoo. So we also have to note, like, is their tattoo properly healed? Stuff like that. Yeah, we just have to like look at everything of your body. But of course, if there's any abnormalities, we don't have to write it down. We just have to write, this thing is normal, that thing is normal, I checked it, it's normal. They're normal. They're fine. Shit like that. Other things, blood pressure. I can't really do it by myself, practice on myself. That's why I would drag my parents to do blood pressure for me. And for exam, we have to do manual blood pressure. Of course, hospitals use their little like cart, the vital machines, to just like manually just gotta like wrap it around their arm and press the button, and it will take their BP, blood pressure. But sometimes doctors do order a manual blood pressure to check, just to double check, or there's some reason that they need to use a manual blood pressure, or there's no other technology available, then you have to use a manual. So we gotta learn how to use a manual. I don't know how to show it to you though. And I show it to you. Oh, I also have to check pulse ox, which is like a little clamp you see in a hospital. They're just like, put it on your finger, and then it will get your blood oxygen and your pulse, right? Heart rate, you can also do pulse rate, vital signs, respiration. You can listen with your stethoscope to listen to the respiration rate and count it, or you can just like look at the patient and see their like chest like going, the diaphragm going up and down to like to count it. Depends. 一個人應該 show 唔到，係我做唔到血壓，我唔係好 show 到血壓，唔好意思。I can explain it though. Let me try to explain BP. So, this is a blood pressure cuff, a manual blood pressure cuff. So, you would wrap it around your patient's arm, like this. And there is like little arrows to indicate where your arteries are, like where this should be pointing at. So you would like go over and then point it at your artery. Oh, this is also there's a little different sizes for a blood pressure cuff. There is, of course, infant. They're really tiny. Like infant blood pressure cuffs can be like this small, incredibly small BP cuff. There's children, a little bit smaller. There's normal adult. There's also small adults, which often used for elderlies, because some elderlies, they literally have bone and skin, literally can see their bones, all their veins. So they have incredibly thin arm. So sometimes they have like smaller adult sizes. They have larger adult sizes, maybe or more muscular or bigger. And there's also a thigh one, in case you can't do any blood pressure on your arm. For example, accidents, or like both of your arm have IVs in, anything like that. But yeah, that's cuffs. And for manual, you'll have like a this is also called a sphygmometer. Sphygmometer. So it will track the pressure you're giving, and they're also like a pump. So you'll like pump this up. Usually I'll do like to 160 to 180, pump it up to there, and then slowly release it. Oh, forgot to tell apart. I need to use my stethoscope and press it. I'll put this on, and then I'll also put my stethoscope, my diaphragm, on their brachial artery to listen. And then other arm, I'll like pump it up, and then slowly and I'll slowly release it. This is tight. Righty-tighty. Pump it, and then slowly release. And then while you release, you'll see this hand slowly go down. And when you start hearing like a little beat, kind of like a heartbeat, like a pulse, when you start hearing a pulse, and wherever it is, that is your systolic pressure. Your systolic, and where it stopped beating, that would be your diastolic. It'd be like boom, boom, boom. When it starts, you look at it, it's like boom. Is that like 150? Well, that's too high. For example, 120. Boom, 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 boom. And when it stops, that would be your diastolic. It would be, for example, 80. So you would write like 120 over 80. Yeah. This thing is hard to use. You need to release that valve gently. And yes, I've seen. Oh, I'm a CNA. Oh, I have a thing. Oops. I do have my CNA badge. I am a certified nursing assistant. So I got my certificate. I got my license for that. So I've already practiced blood pressure, and I've done this before. What's a CNA? Certified Nursing Assistant. So it's basically a nurse's assistant. You do what the nurse basically order you to do. Basically, you can do vitals and other normal stuff. Like, you can do blood sugar. You can also do blood sugar. Collect samples. Clean. A lot of like helping stuff, you know. Normal stuff that doesn't require you to do sterile techniques. One of the most important thing you can't do, like between a nurse and an assistant, you can't do sterile techniques. And also, you can't give any meds. You cannot give any meds to patients unless it's like a cream, like on their skin. That's fine if you're ordered to do so. But yeah, mostly it's just normal things like helping shower, clean their body, help the nurse do stuff, carry stuff, bring stuff, clean stuff, take vitals. The most important thing techs do is vitals, write document, stuff like that. Because sometimes we don't have enough nurses and we need tech. Sometimes it's tech. We call them technicians. They could be CNA and technicians are kind of similar. It's just like tech. It's just like assistant to nurses to do more like casual stuff. Yeah, but it only took me like a semester to get my CNA license. It's like 3 months. But yeah, I got a little bit of experience. I also took the CNA course because I want to know how it feels, and if I want to try to be a nurse. And I liked it. I liked the experience. And yeah. So I got experience. right? And I know how long you should take a BP, so it should like gradually like not quick but slow. But I've seen people, they're like so nervous that they like release the valve really slowly, and I'm always concerned of that person's arm, because sometimes some people do it on me and they like took a really long time to read this thing. First off, it could cut off your circulation. My arms is going numb, so your blood pressure won't be that accurate, right? And it cuts off your patient's circulation. That's bad. I don't think that's good. The patient doesn't feel good, especially for elderlies. They would scream at you. It does not, especially for elderlies. They're pretty fragile, so don't take manual BP that long. They do not like it. They do not like it, so like slow but accurate. A moderate pace, which is hard to like figure it out. You either need to be really careful with this. You need to practice a lot with your own equipment and sometimes with other people's equipment with manual BP. What else? I think there's much else I haven't said. I have other tools we haven't used yet. For example, sometimes if you find wounds, you will use like a little measuring tape to measure how like your width and depth and like height of the wound. Sometimes to make sure, if you're in a hospital, to make sure their wound is getting smaller, so it's healing properly. There's also classic pen light flashbang to check more clearly, like at your hair, if you have lice, anything, your inside your mouth, your nostrils, stuff like that. Pen light. There are also like little measurements there on your pen light. Dilation, circumference. What else? There's bandage scissors. We haven't used that yet, but yep. Bandage scissors for cutting off bandages easier. And what else do I have? Where's my hammer? There we go. Reflex hammers. When you like, you see the doctors, they like kind of like hit your knee or elbows to see if your reflex is fine. But sometimes it doesn't really work that clearly because you have to like really relax for it to like work better. Can nurse give meds themselves? Nurse can for some meds. Normally, the best way is to get a doctor's orders, of course. A doctor's orders to receive your order for a med to give. Of course, you can like call the doctor and you say, I would suggest to get that med, yeah, you know, shit like that. But you can also get med if a doctor is not available or is in a rush. You can call your pharmacist in your hospital to get the med. Or some meds you can administrate when it's like an emergency. If someone is gonna die, and you're kind of sure you gotta give that med or they'll die, then yes, some medications you can give it to patient in urgent situations. Yeah, like even Because when you take the med out of your med card, you have to type and like scan the medicine, and they would ask you like, oh, you don't have an order in. Are you sure? Or like sometimes you have to overwrite something, and you have to like type down the reason to make sure you're sure that you have to give this med to a patient without a doctor's orders or like a pharmacist's order. But yeah, rare situation, very, very urgent situation to give med on our own. It would be great to if you have time to give it like a second opinion or something. If like there's anyone else, especially like a practitioner, an NP around, then you can ask them or something. But yeah.
水煙夫さんいらっしゃいませ。こんにちは。我差唔多講晒我要講嘅嘢或者要做嘅 skills 咯。諗唔到有咩其他可以講。我漏咗邊個咧？我講好 ，Koha さん，佢哋招啊，我冇同你打招呼。But yeah, any question that I hope I can answer? Remember, I'm a student. I'm just a student. I'm not a professional. Not a professional. I'm just a student. Don't trust everything I say. I'm kind of stupid. Yeah, that's so far what we learned in nursing. I am scared to inject someone with a needle. I am incredibly scared giving med. I am scared of a lot of things. I'm not that scared of wound care. No, I'm scared of giving catheter. Because when we practice, our dummy, there's a big hole for urethra. It's pretty damn big. You can't miss the hole for the dummy's urethra. But on the real person's body, our urethra is kind of small, right? So I am incredibly scared. Well, for men, of course, it's like a small hole, but like you know where the fuck it is. It's in the tip of the penis. But for women, there is a lot of skin, fat, like your labia majora around your urethra, and also there's 3 holes. And sometimes my professor said she has put 3 catheters. She had to try 3 times to get it right, because everyone has a different anatomy, and sometimes it is really just that hard to find the right hole. I'm not kidding. And when you put it on the wrong hole, you do not pull it out. So if you accidentally put your catheter inside someone's vagina, you do not pull it out immediately, because what if you go back in and you put it in their vagina again? So you stay there, and then you take another catheter, and preferably you have another nurse beside you, so you can figure this out properly, and then you put it in the right place. And I trust that that people would not put it in the butthole. Even if you do not pull it out until you put it in the right place. Then you can put all the wrong ones out to make sure you don't put it back in the wrong hole. But yes, this is what I'm scared about female anatomy. I don't even know where my hole is. No idea. Never seen it. I don't know. Everyone is different. It is scary. And stuff like, for example, when I get my blood drawn,
I get my blood drawn, they can't find my fucking veins. My veins apparently are hard to find. Pretty damn hard to find. And that's just what happens, because everyone has a different anatomy. Everyone's body is different. So you gotta have a lot of experience. You gotta practice a lot to get things right. And it's okay, unless you kill someone. Unless you nearly kill someone, they're fine. You're fine. And as a student, you will have preceptors and people watching you do it. Even when you document stuff, you also need your preceptor to co-sign what you put in the document. Yeah, so it should be safe. I probably won't kill anyone. I hope. But yeah, I think I've covered almost everything I've learned so far. I hope you guys learned something. Do not trust me though. You can kind of like feel or get the gist of what I'm learning as a student. But yeah, I hope you enjoyed this little demonstration practice. Yeah. I hope in HKT, your first 2-3 hours of Valentine's Day, I hope your first 2 or 3 hours of Valentine's Day are not that lonely, because you got experimented by me. Yippee! 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 Thank you for spending Valentine's Day with me. I hope in the future, it might not be a Valentine's Day stream, but in the future, it might be just like a little hand cam stream. I can practice more in front of you guys and like explain what I'm doing so far. Yep. I'm enjoying. Do you like this stream? Do you like me experimenting on you guys? Is this romantic? Is it romantic? Is this romantic? Is this romantic? Say yes. Say yes. It's romantic, right? It's very romantic, educational. Yeah. Next stream would be either for Hong Kong time, it would be your night time at 9 p.m. HKT. We will play Repo with Ellie, AK, Aiko, Ilo, Chan Chang. If it's you at EST, it would be tomorrow morning, February 14th, morning, 8 a.m. EST. That means I have to fucking wake up at 7. I'm gonna kill them. But yes, that would be our stream. Also on Valentine's Day. Yeah, so Valentine's Day, you will have 2 Valentine's Day streams with me. Are you guys happy? You guys not that lonely. You have Valentine's streams with me. Or maybe, you might have another stream in the early morning. Because I have to work. You might also see me work at my nighttime or your morning. You might see me the whole fucking day of Valentine's Day. But I'm doing different things the whole day. Yes, but that will be it. Thank you so much for watching, everyone. I hope you like these little like layouts, my thumbnail, my little scenes. As I'm using the same Valentine's Day BGM as last year, and like my little outfit, like my little accessories. Yeah, those artists came in clutch. Thank you for those people who made free assets. Make sure to check them out in the link in the description. You have this like little arm with a syringe, and like the hat, the eye patch, and the mask, and like these like little blood splatter on me. I can show you a little bit better. Oops. I'm cut it in half. But yes, Oh, blood splatter on me. A little hat. With a little eye patch and stuff. Yeah. So go check those artists out. Thank you so much for watching. I hope you have a nice Valentine's Day. I will see you maybe in 7 hours, and then I'll see you again in 12-ish hours is 24 hours-ish. Not really. What time? I don't fucking know anymore. I'll see you today. I'll see you again today or something. Thank you so much. Thank you for watching. Happy Valentine's Day. Do you want a more romantic background? To say goodbye? Uh-oh. Wrong one. Oh, also the stinger. Oops, wrong scene. I am not here. You know what? We're going back to this one. We're going back to this one. Where am I? I'm here. Great. DK-san! Konnichiwa. Wait, did you just came in? If you just did came in, you missed a lot of things. Hopefully you didn't just came in. Very romantic, thank you. Yeah. Have a good day, thank you. I will see you later. Let me say goodbye to everyone in this nice little scene. Oh, I should have had one scene that has a hospital setting. God damn it. Forgot about it. A hospital setting scene. Tiri-san お疲れ、シフォンさんお疲れ、ジョーさんお疲れ、クリスさんお疲れ、ホーホンさんお疲れ、ミニキシャンさんお疲れ、ミレンさんお疲れ、ブローウォーターフォークさんお疲れ、新冠ゾーンお疲れ、カラさんお疲れ、エディお疲れ、ムユお疲れ、ワイケイさんお疲れ、大丈夫、モナレンさんお疲れ、ケリージェキさんお疲れ、アイロお疲れ、テンさんお疲れ、コアさんお疲れ、お疲れ、ディーヘンさんお疲れ、スイエンフさんお疲れ。入嚟一陣瞓着咗，頭先啊血壓嗰度射翻，原來咁。Very romantic, thank you. サボさんありがとう、ありがとう。Actually, I'll go back to here. Yeah, this stinger is so fucking cute. This like little heart little stinger thing, amazing. Go check this artist out in the link in the description. They also made other free stingers, very cute stingers for transitioning. But yeah, I got my PPE on. You see this drip? You see this PPE drip? And I have my fucking scrubs, my CNA scrubs on, which is just normal scrubs. I'm not wearing my school scrubs. My school one is actually black. My school one is a black scrub, but it has my school name embroidered on my pants and my shirt, so I can't show that one. But yes, I have fucking PPE on, just for you guys. Even have a mask on for this, which you can't see. I don't want to show my face today. I don't feel like it, unless I accidentally showed it. Anyways, have a happy Valentine's Day. Oh, do you want? I want to show you like a little Valentine's Day bag. My mom got like a big ass bag from her office, but the chocolate is kind of disgusting. But the fortune cookie is surprisingly good. And this little peppermint thing... Hold on. This is actually pretty good. But yeah, happy this is like my Valentine's Day. Happy Valentine's Day ticket. Have a nice day. I will see you later. It's just not focused right now because I put something here. There we go. But yeah. Thank you for watching. Having this Valentine's Day with me, practicing nursing skills with me. Thank you. I hope to see you the next Valentine's Day. I hope you will be my Valentines every single year. Okay? You will be my Valentines every single year, right? And you'll let me do anything, right? Right? Yeah? You come to my house every single Valentine's Day, right? 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 You come here every Valentine's Day, right? Right? I don't know what this is. What was that screen? Oh, I don't have that S anymore. You come here every single Valentine's Day. I cannot hear how loud is my horror ambient sounds. I think it's really loud. Oh, it's not that loud. You'll come here every single Valentine's Day to spend it with me. With no one else, just me. And you'll let me do anything. Oops. I almost removed your cage. Get back in your fucking cage. Right? 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 You'll be my little patient. You'll be my little practice buddy. You'll be my patient. And you'll stay here forever. Yes? 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 Say yes. Say yes. Say it. It's okay. I know you live here now. I'm just kidding. You guys live here. You've been living here for a long time. Since last Valentine's Day. You've been living here. I just went out with you for a walk at the park. And we pretend we have a new Valentine's Day. You live here now. We all know you. I just took you outside for a week. You should be happy. You should be grateful that I took you out for a while, and then you came back here. Cause of course, you want to come back here with me forever, right? Right? You love me. You love me, right? You're forever my Valentines, right? Why aren't you talking? Why aren't you talking? 小老細，你請問食佢哋知啊？我哋啱啱練習完一啲護士嘅skills 啊，即係我幫你量血壓啦，幫你打完針啦，幫你插完尿喉啦，係咯，最後都係離開呢度，咁梗係啦，你都邊個想走啫 ？Why do you want to leave? Who wants to leave? Why would you want to leave me? I treat you so well. I give you so much entertainment. I am your one and only forever Valentines. Right? Right. Yes. Say yes. Say yes. Say yes. Be a good boy or girl. Person. Say yes. Say you'll be my Valentine's forever. Just like last year. Just like last year. And this year. And then next year. And then next. And forever and forever and forever. Yes? You'll be a good boy, girl, or person. Yes? Say yes. Say yes. Say yes. Say yes. Say yes. Say yes. Come on. Come on. You won't leave me, right? You'll never leave me, you'll stay here. Nice and cozy. Say it. Yes. Yes. Good job. Good job. You did so good. You're so nice. I'll give you all the chocolate, all the injections, all the medications for you to practice with me. And we can be together forever after in this little basement. We have a lot of you guys. You guys can be so cozy. You're gonna be friends. Yes. And I'll see you next Valentine's Day. You'll be my Valentine's Day forever and ever, ever. Isn't that great? You guys can sleep now. You gotta sleep, gotta work, gotta do something, gotta eat. Do your thing, you know. Have a nice day. Have a nice Valentine's Day. I will always be here with you. Always and always watching you. But yeah, hope you have a nice day. And I guess if you're bored, if you need to watch something, I can recommend someone else. No, I'm just kidding. I'm not recommending anyone. You stay here forever until my next stream. Goodbye, everyone. I'll see you next Valentine's Day. Well, see you today. See you today. I'm sorry I don't have this kink. It's not a kink thing. It's about loyalty. It's about loyalty. Okay? You stay loyal to me. Only. Right? 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 Yes? Good. Alright. I'll let you rest. I'll let you go. You did such a good job today being my little patient. I'll let you go just for today. Give you a little rest. Give a just a little poke. Don't worry. This injection is just a little poke. Sleepy? Yeah, sleepy. Good. Good. Close your eyes. Sweet dreams. Good night. Good night.
Happy Valentine's Day. Goodbye.